Mayor of Brampton, and welcome to our weekly COVID-19 briefing. I am joined today by City Councillor Jeff Bowman, our Legislative Services Director and Commissioner Paul Morrison, our Medical Officer of Health, Lawrence Lowe, and we have a special guest this week, my friend and the Mayor of Caledon, Alan Thompson. We have collectively advocated to other levels of government so that we can work together, that we can do more to protect our region. And today I want to mention a few of our ongoing efforts. First of all, we're all in this third wave, and I want to highlight why the vaccine pivot was so critical. You know, this virus isn't equitable. It isn't fair. It attacks densely populated areas differently than it does rural areas. It attacks crowded factories different than it does people living in working from home in executive settings. And so we needed to be nimble. We needed to focus on where the outbreaks are happening. So the provincial announcement last week was a great relief that we were going to focus on hotspots, that we were going to focus on essential workers. You know, my message a week ago was vaccinate essential workers, vaccinate essential workers, vaccinate essential workers. And this week my message continues to be that. Vaccinate hotspots, vaccinate hotspots, vaccinate hotspots. Because although the goal that was stated by the province is really encouraging, we need to see details on how we're going to get there. Right now, the enthusiasm to get vaccinated has been incredible. Every day I get calls from companies saying, sign me up. Just yesterday, Canada Post, their union, Kaiser Maroof, said they've had 3 outbreaks and they want on-site vaccinations. Magna said they've got literally thousands of employees in Peel. They will bring in their own physicians and nurses as long as they get the vaccines. Canadian Tire Distribution Center, Amazon, the list goes on and on. Not to mention, I am getting literally hundreds of emails from individuals in hotspots between the ages of 18 to 49 saying that they were encouraged to see the provincial announcement and they want to sign up. And so we're eager to hear how additional supply and allocation will be provided, because I know from speaking to public health and speaking to Dr. Lowe, he said if he has the supply, he'd vaccinate everyone. We hate being in the position where you have to choose between vaccinating a senior citizen and an essential worker, or vaccinating someone who is in a vulnerable congregate living setting, and someone who's in a hotspot but may be younger. The average essential worker is 36 years old at Amazon, and that's typical in many of our essential workplaces. And so I guess what I really want to highlight is supply, 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 supply. We can have these stated goals that are so bang on. And the announcement from the province a week ago about vaccinating hotspots, focusing on essential workers, focusing on hotspots, bang on. It was music to my ears out of Queen's Park, but we need the allocation so that we can do that work. And I can tell you, we are getting a little bit impatient because we're excited to get this underway, but I'm inundated with requests now from factories and constituents who want to join that queue. And so I believe Dr. Lowe will have more government saying the supply issue is over. We have not seen that in Peel Region. We're not seeing that on the ground. We need those allocations. And I think what you saw in Scarborough earlier this week speak to the fact that we still have challenges with the supply chain. And heaven forbid that happens in Peel, where you have to cancel appointments because of shortage of supply. I also wanted to mention this week an update on outdoor amenities. Hearing from public health that outdoor amenities are generally safe environments. We continue to open outdoor amenities. Our Peel Village Golf Course will reopen for the season next week. In mid-March, we reopened all our tennis courts. We continue to do maintenance on our outdoor bike lanes, walking paths, and running paths. It is important to get physical exercise, and so there are safe ways to be outside to stay healthy and enjoy our outdoor amenities. And updates are available at brampton.ca. For a William Osler update, I want to note that they currently have 71 COVID-19 inpatients at Brampton Civic. That's really high, and it shows how the third wave is challenging our hospital system. We have 13 patients in ICU and another 44 COVID suspect patients. Osler has now administered 69,590 doses of COVID-19 vaccine and has provided 396,000 COVID-19 tests. And so the vaccines they've delivered are on top of Peel Public Health. So Osler continues to go above and beyond, looking at ways to help our community. So on that note, I'm going to call up Mayor Thompson, who I've been working closely with in terms of the urgency of vaccinating our essential workplaces. And I would note there are so many commonalities and similarities between Caledon and Brampton. Our factory settings bleed into each other. You look at an Amazon plants and Caledon plants in Brampton. Many of the people that work in some of the factories in Caledon come from Brampton, and we've really been working together to advocate for Peel Region, and he's doing a great job as Mayor of Caledon. I want to welcome him up to the podium.
Thank you, Mayor Brown, and you're completely correct on what you're asking. And first of all, I definitely want to say I want to do a shout out and a helpful thanks to Dr. Lowe for the fine job that both he and Peel Health are doing in getting needles in the arms. I think in my opinion, we're the best in the province in getting that job done. But with that respect, these pop-up clinics at this time with Peel Public Health following the provincial guidelines are focusing on doing just that. But if we use like Amazon that's in Caledon, for example, as what Mayor Brown just said, 80% of the 3,500 come from Brampton. We bleed into each other's area. And that statement where Mayor Brown is going is that Dr. Lowe has been asking that the province make all of Peel a hotspot community. I know we're going by postal codes, but the way we bleed into each other's neighborhood, it just doesn't work. Peel needs to be a hotspot, period. End of story. And as well as what I'm asking to back up with where Mayor Brown is coming from, we need a better coordination of communication when the province makes bold statements about opening eligibility, a need to locally deliver and have the vaccines to come with it. And we definitely need our employment areas all to be vaccinated, but to do that, especially with the Amazons that can definitely deliver, especially as Mayor Brown said with the other industries, but we need the vaccines to come with it. So we're pleading not just with the province, but as well with the federal government. We are a hotspot area. We need the vaccines. We will get it done, just like what we've been doing, putting needles in arms. We are asking the province to please give us the vaccines so that we can get our employment sectors like the Amazons, the Canadian Tires, and everywhere else, that we can get those needles in the arms and also get our community vaccinated as well. Because if we can have, with the stores being shut down, with the employment areas with people getting needles in the arms, keeps our families safe, keeps our schools safe, it keeps our community safe. This is just another way of getting our community covered, especially when we're a hotspot. Thank you. I'll now turn it back to Mayor Brown.
Okay, thank you, Mayor Thompson. Now I'm going to call up Councillor Jeff Bowman, who will share an update on the city's efforts on bylaw. And thank you, Councillor Bowman, for your diligent work helping with Team Brampton here at City Hall.
Thank you very much, Mayor Brown. City Councillor Jeff Bowman, Ward 3 and 4. I'll give you a very brief update and let you know some of the numbers. On our social support task force, we've been working with the most vulnerable in our community now for about a year. During that year, we've had 3,300 grocery deliveries to families, a lot of the families with children who were in need of food thanks to the COVID shutdowns. We also had 52 people relocated. These were people who had no place to go, no house, and we've relocated them with the help of the Region of Peel. Now, it is getting warmer, so we may see encampments start to form again along our rivers, creeks, under some bridges, in the parks. And if you see them, please call 311, and we will make every effort possible to help those people get into a safe home or a safe place where they can be fed and where they can receive the support that they need from the various agencies. We also distributed 160 school kits for kids. Despite the fact schools are closed now, we did have those kits available to them. And we were able to get sharps, boxes installed in various areas in the city to help this sharp problem. People could put them in the box, and we were able to get 6 porta potties downtown. So it is a very vulnerable section of our population, and the social task force is doing everything we can to take care of those individuals. As far as our bylaw goes, I'm astounded by the numbers. Our Commissioner Morrison is doing a fantastic job with his staff. We're basically 100 days into this year, 100 days, and already his staff have taken in complaints or proactive investigations 17,000. That's right, 17,000 in 100 days. Just last week, there was 750 complaints and investigations looked at. Over the course of a year so far, just in 2021, we've also had 652 warnings or charges laid. That's incredible. We've been in this for a year now. And, you know, I don't know what it's going to take for people to become aware to wear your masks, to social distance. Places of worship, as of the new rules, are only allowed to be at 15%. And we've seen some of them far greater than that as well. Masks, gloves, they're still being left on the ground, littered in parks. Please put your masks and your gloves in receptacle bins wherever you can. And if you can't, please take them home with you and put them in your garbage. In our parks, Mayor Brown mentioned that, you know, we've got a lot of park facilities, we've got the fields open, but please do not participate in contact sports or scrimmages or anything like that where you're going to be within the 6 feet of one another. We're just asking for this thing to spread even more. And last thing is that we know there's a planned protest for Friday in Gage Park downtown. We're asking those people, please, you know, we're in a pandemic, hold it off. There's other ways to get your message across. Write letters, send emails to your school trustees. That's the way to handle that issue. We've got a lot of other things that you could be doing, so we're asking you, please do not congregate in the park this coming Friday. And of all the cases, 60% of them happen to be in Brampton. But as Mayor Thompson mentioned, we are so interconnected that we really have to get Peel as the region to get all the support we need from the Ontario government. So that is it for the updates, and thank you very much, and I will turn it back to Mayor Brown.
Thank you, Councillor Bowman, for the detailed update and your hard work. And on that note, it's my pleasure to introduce Dr. Lawrence Lowe, who is working day in and day out to protect public health in Peel Region.
Yes, thank you. Good morning. Thank you, Mayor Brown, Mayor Thompson, Councillor Bowman, for your updates and certainly for your continued leadership throughout this pandemic. I know that we're all focused on vaccines, but I will start my update in respect of where we are in the third wave here in our community. This week, Brampton's test positivity is at 20%, with a weekly incidence rate of 381.6 cases per 100,000. In Caledon, we are at 12.9% positivity, with 305 cases per 100,000. These are the highest numbers we have seen in our community since the pandemic began in spring 2020. Area hospitals are bracing for disaster. All surgeries and pediatric admissions have been canceled. There are now call-outs for healthcare providers. I myself received one of them to support the significant demands for care that are occurring in the hospital and in ICU and in non-traditional places such as repurposed outpatient clinics like the fracture clinic. While our over 60 plus population still represents the majority that is facing severity and mortality, we are also increasingly seeing patients that are younger, sicker, and staying longer. And over the first 2 waves, we know that adherence to measures warded off the pictures of disaster and tragedy that we have seen elsewhere in the world. But make no mistake, this wave is different. Our current situation is incredibly dire. We must decisively act to save lives and to allow our vaccine coverage to succeed and grow. As other places have done, we must close, vaccinate, and exit. So once again, I urge all of our residents, please stay home as much as you are able. Connect virtually and limit contact with those that you do not live with, and if you must meet for an essential reason, always mask, distance, and keep it outdoors. If you are sick, do not meet. Get tested and self-isolate unless you need medical attention. I also call on our employers, while we work to figure out this vaccination priority that's been identified, please support our essential workforce at this time. Your workers cannot limit their contacts without your help. Ensure that you have a COVID-19 safety plan in your workplace. Ensure that the precautions are being followed. Consider reducing the work volume and capacity to limit risks. And if you do so, provide paid leave to your workers, and also ensure that you're providing paid leave to your workers if they fall sick or require time off for testing or to get vaccinated. Finally, I call on all of our residents to get vaccinated when your turn comes. In accordance with provincial direction, hospital and community vaccination clinics in Peel can be booked online for all residents aged 60 and over, born 1951 or earlier, or those 50 and over between 1951 and 1961 if they live in a provincially defined hotspot. Please note that it is the province that defines these hotspots by postal code. However, with 25 of 33 neighborhoods and 85% of our population Peel defined as such, it is Peel Public Health's view that all of Peel should be designated as a hotspot for simplicity and consistency in prioritization. Our mobile program, which has been in effect since January, also continues and has delivered 10,000 doses as of this date to apartments and other senior settings, shelters, and the homebound in our community. We are excited that with recent announcements, we are now able to expand our mobile offerings into other venues such as community centers and workplaces as pop-ups for all comers over 18 plus. Tomorrow we will be announcing details on a pilot pop-up for special education workers targeted for the end of the week, and we are in the process of finalizing plans with our provincial partners, community and faith-based organizations, as well as local businesses on a way to augment and expand our mobile offerings. peelregion.ca/COVID-19 vaccine remains your one-stop shop to book and confirm eligibility. Please note that the changes in the provincial priorities may delay our original projections to move to vaccinating those 45 and older by the end of the week. However, we are now vaccinating nearly 100,000 residents a week across all our channels, with a record 12,500 doses in one day delivered this past Saturday at all of our mass clinics. We can avert disaster if we stick to the game plan to stay home, stay apart, and stay safe, and when your turn comes, to get your shot. Close, vaccinate, and exit. And with that, I'll thank you and pass it back to Mayor Brown.
Thank you, Dr. Lowe. On that note, we're happy to take questions for myself, Dr. Lowe, Councillor Bowman, Mayor Thompson, or Paul Morrison, our Legislative Services Commissioner. First question is Graham Frisk from the Brampton Guardian.
Good morning, guys. How's it going? Yeah, I guess my first question would be for Dr. Lowe. Dr. Lowe, we've been, obviously we haven't vaccinated a majority of the community yet, but I'm just curious as to at what point will we expect to see sort of herd immunity following and seeing some results from the vaccines?
Yeah, absolutely, Graham. I think real-world evidence as well as hypotheses was that around 65-70% is where you would start to see an eruption of transmission in a community. But we know that in countries such as Israel, the UK, once they even got to places like 40%, they were starting to see changes in hospitalization and transmission patterns. I'm very excited that our community is already over 40, probably closer to 50% vaccinated over 60 plus, which we know is the segment that is hardest hit. We just need to continue with our mass vaccination program and these added mobile offerings to continue getting needles and arms out there. But I would echo what our mayors said in their remarks as well. Supply does continue to be a challenge. Obviously, we get numerous entreaties for people who wish to be prioritized in accordance with the new provincial announcement. But there's a recognition that obviously if we had unlimited supply, I would prefer to vaccinate everyone as quickly and as efficiently as possible. But we are still managing a growing supply to try to get to that mark. Absolutely. Thanks for the question.
Yeah, sure. Okay, yeah, my follow-up would also be for Dr. Lowe. I've been looking at the data on the website, on the region's website, about the case numbers and the variant counts. And it appears the variant counts, or at least according to the data on the website, have been going down pretty significantly over the past few weeks, whereas the original strain has skyrocketed again. So I'm just wondering, what's the situation with the variants right now, and how much of a percentage of these cases are they accounting for?
It's a good question, Graham. We actually received word from the ministry that our number of variants was temporarily impacted by a data glitch, and I believe a correction should be coming to that data. Either way, regardless, in terms of variants or wild-type coronavirus, the reality is that we are seeing the highest numbers of transmission that we have seen since the pandemic started. There's no way we can vaccinate our way out of this at this time. We really need people to reduce their contacts and interactions, either by staying home if they're able, or for employers to ensure that their employees are absolutely protected during this time. Thanks so much.
Okay, thank you, Graham. Our next question is Irene from 680 News.
Good morning. My question is for Dr. Lowe. I'm wondering what percentage of any vaccination appointments go filled? Are there days that some are not being filled, and any issues with vaccine waste?
So thanks, Irene. No, we have a zero waste policy. We are constituting vaccine as we go. Our hospital clinics are doing the same. And I can share, we have a very low no-show rate. In fact, the Saturday that we actually were booked out, we were booked at 130% capacity. I think that shows our commitment to just try to get through this as quickly as possible. And we're really grateful that there is interest from the community. That's my encouragement as well. If you're eligible, please, it is hard to get an appointment, but if you're eligible, now's the time for you to try to get one and make sure that you're doing your part to stop this. Thanks for the question.
My follow-up is also for Dr. Lowe. There's some confusion with the provincial portal. Someone in Vaughan can book in Mississauga, someone in Peel can book in Toronto. Are you getting similar questions from residents about how to book? And do we know a percentage of people from other regions crossing over?
So we don't track the percentage of people that are crossing over. We track the percentage of our residents that have been vaccinated. As I mentioned, we're over 40%, starting to get closer to 50% of our 60-plus vaccinated. In respect of the provincial booking system, my encouragement would be if you're showing up on the booking system, it will show clinics that are within a 100-kilometer radius of your postal code that you enter. But given just the sheer volume that we're having in our mass vaccination clinics right now, booked out, for the rest of the week, I think it may be difficult to find an appointment. I would encourage our residents to continue making sure that you're online and also checking our hospital sites as well. Thanks so much.
Thank you, Dr. Lowe. Next question is Shauna Hunt from City News.
Good morning. My question is also for Dr. Lowe. So Scarborough, as actually Mayor Brown mentioned already, Scarborough shut down 2 big vaccination centers yesterday. 10,000 at least appointments are being canceled. York Region has done, similar shutdowns too, all due to lack of supply. Is Peel in jeopardy of closing clinics because of, supply issues?
So, Shauna, I think this is a really great question, and it speaks to the limited supply that we are working with. I think here in Peel, we have carefully navigated the limited supply in a manner to ensure that our clinics can stay consistent and stay open. We also know that in some other jurisdictions, they diverted supply to mobile modalities or to spread it out to a whole bunch of small clinics. We've stayed the course here in Peel and said, with our supply, fastest and most efficient way, continue with our mass vax and supplement where we can with mobile and community outreach. So at this point in time, we are projected. We always run out just before every allocation comes in. We are concerned about the Moderna delay, but we are in conversation with the ministry to figure out how we can continue to ensure that supply stays stable and constant, which is absolutely vital for a hotspot like ours to ensure that we can continue vaccinating our population. Thanks.
Okay, my follow-up is in regards to testing, Dr. Lowe. Just over the weekend, it was impossible to find a test in Mississauga. In Brampton, I believe there's one location that was offering, that had space to book an appointment. And so I'm just curious what's going on. Why in the third wave, after, more of a year than this, it's so hard to find a test? And why would someone showing symptoms in Mississauga, their only option is to go to, Brampton, a different city, in order to get a COVID test?
So as you know, Shauna, the province controls testing, and you'd be better to direct that question to Ontario Health. However, my view as a physician and expert in regards to this is I think it reflects the level of transmission we're seeing in our community, and it reflects the significant strain and demand that's being placed on our healthcare system. People who are symptomatic seeking a test. So, in respect of the capacity challenges that you're describing, you'd be best to ask Ontario Health. Thanks so much.
Okay. Our next question is Sumit from Omni News.
Hi there. Thanks for taking my question. It'll be for Dr. Lowe. Regarding household transmission, with the really high numbers, we're seeing over 40% of cases in Peel being attributed to household transmission. I'm just wondering, 1 year into pandemic, really, what can be done to lower those numbers?
Thanks, Sumi, for the question. It's really great. First of all, vaccination. So if you are, eligible for vaccine, please make sure that you get it. Please make sure you book, because that's one way to make sure you're protecting your loved ones, make sure you're not bringing it into your home if you are eligible for vaccination at this time. Secondly is to make sure you're sticking to the precautions, so making sure you're distancing, masking, try not to mix with people outside the household that may introduce it into a household. And if you do fall sick, making sure self-isolation means self-isolation, so staying apart from people within your household, or in the event that you cannot safely self-isolate, that you actually avail yourselves of the self-isolation centers that still continue to be operated, that have now seen over thousands of people through that facility at this time. And then I think the final thing is just really to make sure that you're being aware, certainly of any patterns of transmission. We do know that being aware of the situation. We know that community transmission is high. We've seen with the variants, certain households, the virus gets in, and it's no longer just infecting a couple other people in the household, it's infecting people around the dinner table. So you got to make sure you're not introducing it, getting vaccinated if you can, and self-isolating if you do get sick. Thanks so much.
Thank you. Follow-up is regarding the isolation facilities. Do you think that they're being used fully, or is there any barriers? Maybe people in the multi-general homes may not know that it's available to them, or do you think that the community has been fully using the facilities?
Well, Sumit, I think we've done our very best to make sure that people know, and I don't have the specific number. You can contact our comms associate afterwards. I believe we're at 1,500-ish people that have used that facility, and that's just over the last few months. So we do know that the facility is being used. To the extent that there is a challenge where we don't have paid sick days, especially for a lot of temporary and agency workers, those individuals aren't able to make use of a self-isolation facility because they can't take time off of work to do so safely. So we need paid sick days. We continue community agency outreach, and we also continue to make sure that people are messaged on cultural and linguistic channels to make sure that they're aware of that facility. And of course, ensuring that people get more vaccinated will also help in the long run to decrease the transmission rates and decrease the need for those facilities as well. Thanks.
Thank you, Dr. Lowe. Our next question is Sabrina from the Mississauga News.
Hi there. So my two questions are for Dr. Lowe. So for my first one, so Dr. Lowe, in your opinion, why are we continuing to see these negative trends despite ongoing lockdown and restrictions? You mentioned that we are in a dire time. So where did we go wrong, and could our current situation have been avoided?
Yeah, thanks, Sabrina. So you have to remember the picture we're seeing now is reflecting what we were doing 2 weeks ago, right? And so 2 weeks ago, we were in the process of reopening retail. We had reopened places of worship. We had also reopened outdoor activities, but to the extent that the outdoor, transmission is significantly diminished compared to indoors, I don't think that's what drove it. I think to some extent we just kind of came out of our shells. There were schools that were opened up and the community around them, and I'm not saying that there was transmission that necessarily occurred at great lengths through the schools because there were measures in place, but the community was gradually getting bigger and opening up more and more just at the end of March there. I think the end of the March represented the culmination of what was a stepwise reopening throughout March. I for one had advocated trying to remain in gradual measures, gradual reopening, remain in measures for as long as possible. That's what I think deferred most of our wave with the variants starting to take hold, and we didn't necessarily see the significant increase in rise that other jurisdictions in Ontario did from mid-February, where they all had to go back into grey lockdown very quickly away. So we've always had high levels of transmission, and even for us, just even a little small thing, just given how big our population is and where we were always at risk of just taking off again, unfortunately. Is there a follow-up for any of us?
Yes, so my follow-up question, sorry, would just be for you. So last week, the hashtag I support Dr. Lawrence Lowe was trending on Twitter, praising you for moving ahead with switching schools online a week before the province did. Many were saying that you had showed great courage and compassion. I'm wondering what your thoughts are on about that.
Well, I think I've been well supported throughout this pandemic, by an excellent team at Public Health. I've also been well supported by, a council and a community that has really understood the gravity of the situation and the context that we're facing. I think, beyond the hashtag, I think the more important thing is to recognize is that there are still people out there in the community who are getting sickened by this disease, who are passing away from this disease, and we also know there are many people who continue to be impacted by the measures that are in place to really try to bring this under control. So I would prefer that, certainly our focus be on really trying to bring this pandemic under control, really making sure that, I'll continue to give my advice regardless, but that we're all continuing to work together to stay kind, stay patient, and make sure that we're closing, vaccinating, and exiting. Thanks for the question.
Okay, our next question is Nikki from the Bramptonist.
Good morning. First off, thank you for your team's persistence throughout this pandemic in speaking up for Bramptonians, which has helped prioritize vaccinations for frontline workers and those living in hotspots. But with continued delays in vaccine supplies, mixed messaging about variants, overburdened hospitals, vaccine hesitancy, what seems to be life cycles of lockdown, do you have any concerns about people's continued confidence in government direction?
So this pandemic has been uncharted territory for everyone. I think the more we learn about how the virus works, the more we adapt. And I think some of the changes on outdoor amenities reflected a greater knowledge about how the virus transmits. I think right now we're learning about the variants and how they're more dangerous. And so I do think there is a high level of trust amongst the public when it comes to the public health guidance. I think it's important we communicate it clearly in multiple languages, knowing the mosaic that is our community. But I do believe there continues to be a high level of trust and confidence in public health. And I'll see if Mayor Thompson wants to speak to that as well from a Caledon perspective and making sure we have the buy-in of the public.
No, thank you, Mayor Brown. And yes, it is something that's extremely important. This is a volatile virus. It's a survivor, and it'll do anything to survive. So as much as we bring vaccinations and everything, long as it's got a host, it will continue, and it will continue to spread. We've seen a number of variants, and I can guarantee you we'll see more of that in the next 3 years. So we really need everybody to pay well attention. Wash your hands, keep your distance. Do not go out unless you absolutely have to do so necessary. And our biggest challenge is we just need vaccines. Thank you.
And Nikki, is there a follow-up?
Yes, there is. Are you having discussions about the long-term impacts on the physical, mental, and financial health of the city and its citizens?
Yeah, so I think something that we struggle with on a daily basis. One of the things that keeps me up at night is I know I get the emails, I get the letters, I know the pain that's out there from small businesses that are really struggling, people who have poured their heart and soul into these businesses, and there's a new one that comes every day. And I know the mental health challenges that are associated with a pandemic, and I'm worried about the rising rates of obesity and how this is going to compound it because people can't get outdoors. So this is something we think about. It's not as simplistic that we get through the pandemic. There will be some lasting repercussions. And I know Councillor Bowman was meeting with a few small businesses recently. I look at Al's Barber Shop and people who are institutions in our community. And it's a tough go. And so I would say that we're all well aware of it. And the sooner we can vaccinate our community, the sooner we can get out of this pandemic, the sooner we can get life back to normal where businesses open again, people can be out and gather together and be healthy. But this is a very dangerous virus that is reaping havoc in our healthcare system. Our next question is Nitin Chopra from Prime Asia TV.
Thank you. Good morning to all. My question is to Mayor Brown. Mayor Brown, every week you ask for supply. This question is with regard to the shortage of vaccine. Today, 10,000 appointments got cancelled in Scarborough, and those were all 50 plus living in hotspot areas. Few days ago, we saw that Wonderland in York region, they got cancelled. You are asking for supply. Everybody is asking for supply. On the contrary, when Member of Parliament Sonia Sidhu made a statement that there is no shortage of supply here or in Canada, how you want to respond to that?
Well, let me say, the notion that there isn't a supply issue in Canada is false. It's as simple as that. It's not accurate. We have a supply issue in Peel Region. If it was up to Dr. Lowe, he'd be vaccinating everyone right now. He would have been vaccinating everyone 6 months ago. Frankly, we wouldn't be in the fight that we are right now with the variants if we had have had the type of supply they had in other countries. There was actually a really powerful clip on CNN just a few days ago highlighting the vaccination rates in the U.S. compared to Canada and why Canada is struggling. And I think there's a number of reasons. The lack of domestic production, procurement contracts that didn't focus on the time of arrival, more so on the quantity. You know, there's been some missteps on our supply chain, and we're facing it. And so the notion that there isn't a supply issue is simply wrong. And you hear Mayor Thompson speaking about that regularly as well. We need vaccines, and we want to vaccinate our factories. We want to vaccinate our educators. I want to vaccinate our postal workers, our transportation operators, our bylaw officers. The list goes on and on. We have so many worthy groups that need to be vaccinated, and if we had the supply, we can. It's not like Dr. Lowe's in his office saying, I don't want to vaccinate this vulnerable group. Our physicians believe in science. They believe in vaccines. They believe vaccines saves lives. But we need those vaccines and that supply here. I'm not sure if Mayor Thompson would like to speak to this as well. Sure.
Thank you, Nitin. Definitely, it's about supply and working forward on how we get there. And again, Mayor Brown's quite right, is on the procurement processes and maybe the short-sightedness previously in governments and taking away the R&D and discouraging the pharmaceuticals to be here to produce it ourselves. So it's what I call learnable moments. And going forward, I know in the future, we will make sure that we have the capacity to protect our own public without looking for cost-cutting measures, both federally and provincially in the past. We're not here to blame anybody. We just need to figure out how we can go forward. Our biggest challenge is we are putting the pressure on the federal government for more vaccines. I think Moderna is what we're seeing right now. They're trying to expand their output similar to what we've been with Pfizer before. I think it's just patience getting through there and just asking everybody to be extremely diligent. That's what we're really asking for. We're doing our utmost to get our share, and we'll continue to do our share. And as we try to bring in businesses and employers to be able to vaccinate their areas, we can't take it out of our own supply. We're asking the province, you got to find us that extra supply so we can do that. We're a hot spot, full stop. Peel is a hot spot, full stop. We need vaccinations, full stop. That's our ask. That's all we can do. And we're asking everybody, do your part by being diligent. Thank you.
Thank you. I have a follow-up. Anyone can answer that. A few days ago, Premier Ford appealed to the federal that federal should make more tougher restrictions on the airports on our borders because UK variant is spreading very fast in India, and he was concerned that it may enter here because air travel was never closed in pandemic also. Only now recently from January onwards there is a hotel quarantine or a checking. What do you want to say on this air travel in the borders?
So great question, Nitin. And let me say that last March, Brampton City Council did some advocacy on this. We wrote to the Government of Canada asking for the airports to be closed. Councillor Michael Peleschi actually initiated that push. I believe at one point we even passed a motion at Council. We were concerned that with airports that are fully operational, with the lack of testing and at one point even no vaccine or testing requirement at all, it created an untenable situation where variants were going to get into the country. And I think if we have had a closed system, which is difficult because of the long border with the United States. But if we had a closed system like New Zealand, it would be a very different dynamic. And so I think wherever there is entry ways for variants to enter our country, it's a problem. And so I would welcome a further closures of airline routes. I think it's about protecting the public, and really no one should be going on a vacation right now. Any air traffic should be limited to the arrival of critical goods and medical supplies. I'm not sure if Dr. Lowe wants to speak to this as well.
Yes. Thanks very much for the question, Nitin. I think it's important to say two things at this point in time. Stricter travel restrictions is not going to address the current issue that we have right now. We have widespread community transmission of variants throughout the region of Peel and throughout Canada. The only way we're going to get out of those is through the measures and then allowing our vaccination coverage to increase in the way that it did in Israel or in the UK. I think what I will say in respect of travel measures, I recognize that we were never going to be like a New Zealand or Australia. We share a significant land border and significant integration with what I think was, frankly, one of the most challenged COVID-19 responses on Earth that occurred in the United States. The fact that we were able to keep things under control as long as we did is really a testament to our community coming together, reducing contacts, reducing interactions, sticking to the precautions and protocols through 2 waves that has seen us really keep our death rates at some of the lowest levels compared to G20 and G7 countries. But what I will say is once it is done, once the vaccine coverage gets to a certain level, we really do need to look at that broader question around the border at the federal level, because we will know that there will be many other countries out there where there hasn't even been a single dose given, where COVID continues to rage unabated, and that we need to absolutely look into how we'll continue to keep our community safe at that point in time. Thanks so much.
Thank you, Dr. Lowe. And our last question is Patty Foley from Just Saying Caledon. Patty?
Hi, good morning. Hi, good morning, everyone. Thank you for taking my question. I guess my question is for Dr. Lowe and or Mayor Thompson. It would be respect to the town of Bolton. So you have the densest population in Caledon. In fact, over 1/3 of the population in Caledon, sitting in a postal code that is not an identified postal code. On the east side of Coleraine Drive. On the west side, you have one of our largest employment areas, Amazon, Canadian Tire, and so on. And of course, there is bleed, whether that's people going home from work, stopping to get a meal, getting gas on the way home. There is bleed. If the province goes ahead and identifies all of Peel as a hot spot, are you ready to flip the switch for Bolton? Do you have space identified for a clinic? Do you have immunizers lined up ready to go? How quickly can you get boots on the ground and make it happen for Bolton if the province says yes?
So thank you for the question, Patty. I think there's 2 ways I would answer this question. First of all, regardless of whether we're ready or not, I think just for communication purposes and consistency, it makes sense to just say Peel is Peel. I think that's the way we've kind of communicated it throughout the pandemic, and especially because the one site in Caledon right now at Caledon East is only bookable on the provincial booking system, and it's just a matter of adding those postal codes into the provincial booking system and then just being able to have that accessed. So I think that's the first thing. I think regardless of the capacity pieces, I think Peel should go as Peel for consistency of messaging. I think for the second question, on the topic of capacity, we are bringing additional capacity online every single day. We've expanded from 8 to 20 immunizers at Caledon East Community Centre. We know at Bolton there is a pharmacy that has been identified there. There is a primary care clinic that has been oversupplied there. And certainly with the pop-ups that are currently being considered and discussed, we are trying to figure out what the best way and what the most equitable way is to make sure that we're covering things off. So I think to the extent that we can try to make sure that Peel is treated all the same, the capacity is coming on more and more online every day, provided that the supply also comes in. Thanks so much for the question.
Is there a follow-up question, Patty?
Yeah, one more, I guess. Again, for Dr. Lowe. In a perfect world, if all kinds of vaccines became available suddenly, do you see a situation where it might be possible that people's wait time for their second vaccine gets shortened up? Because we have people who booked their first shot for April, who of course aren't going to be getting a second shot until August. And that's a long time from what was initially proposed as being the optimal timing. Do you see a situation even possible where that gets shortened up and people can get second doses sooner?
Yeah, Patty, I would start by saying that the optimal timing is actually yet to be determined. I think the 21 to 28 days was basically initially determined through the trials that the vaccine company ran, but there was good evidence out of the UK and Israel that showed that lengthening doses up to a point would provide the opportunity for us to provide more protection to people more quickly, while also giving fairly robust protection for those who are initially vaccinated to the tune of 80 to 90%. Of course, the evidence and the studies and the data keep coming to determine what that optimal time frame is. But in general, with the minimum interval, you're really trying to avoid giving the two doses too close together, as opposed to, at a specific. You think about childhood immunizations, you don't have any clinics that bring people back exactly at 60 days or 90 days. There's a bit of a range that can be allowed for there. So I think there's that. But certainly, if there's more supply, I imagine the federal and provincial advisory committees would review and try to consider how that might change their recommendations, and we would abide by those. Thanks for the question.
Thank you, Patty. I just want to close by adding that I full-heartedly support Mayor Thompson's request that all of Bolton be considered a hotspot. Our communities are too interconnected. The reality is it's the same families, the same neighbors, the same work environment in our various communities, and in some cases the same companies that they work for. So I think the call that Mayor Thompson has made on hotspots is one that's very valid. And although Brampton is completely designated as a hotspot, I think every postal code in Brampton, I want to add my support, that I think it helps all of us recognizing that the spread is much broader than that. That covers all our questions today. Thank you for tuning in for our weekly COVID-19 update. And until next week, stay safe, stay healthy, listen to the voice of public health. And thank you so much to Paul Morrison, Dr. Lowe, Mayor Thompson, and Councillor Bowman for helping with this week's update.